How do you decide whether you should have a hysterectomy or just take out your fibroids, which is called a myomectomy? I see many patients in my office who have this dilemma. Should I do a myomectomy or a hysterectomy? Here are my top 3 tips for that. So number 1, fertility. So if you are still trying to grow your family or get pregnant, then clearly a hysterectomy is not a good option because you still want to retain your uterus if you are interested in carrying children of your own. Otherwise, for fibroids, the best thing to do is have a myomectomy. Number 2, your level of tolerance for recurrence. Many patients want a guarantee that once they take out their fibroids, it's not going to come back. And this is just something we cannot guarantee. Fibroids can often return, not the same ones obviously that we just took out, but other ones. And so if you are a fibroid former, chances are you may get other fibroids. Now, if you're in your 20s or 30s, this risk is higher versus if you were, say, 48 or 49 and close to menopause. But there's no way to fully guarantee that fibroids will not come back if you do a myomectomy. And lastly, number 3, your risk of, your level of tolerance for symptoms. So if you are so tired of going to the emergency room for blood transfusions or taking birth control pills or getting treated for fibroids, you never want to deal with it ever again, then a hysterectomy is the best option because it is final. Once you take out your uterus, all your fibroids will be gone and there's no way that they're going to recur. However, if your symptoms are bothersome, but not so bad that you want to remove your entire uterus, then certainly a myomectomy is also an option. So those are my top 3 tips for considering whether you want a hysterectomy or whether you want to proceed with a myomectomy. Let me know if you have any questions.